Distinctions in the African American community include being less likely to come into the drug through opioids. Studies show doctors are less likely to prescribe opioid painkillers to blacks than whites. And even with prescriptions, blacks in low-income neighborhoods can struggle to find a pharmacy that has the opioids on hand to fill those prescriptions. There's less medical access as well. Overdose deaths have risen sharply in Marion County in the period from 2000 to 2016. In 2000, Marion County reported 28 deaths from overdose, 270 in 2016. In 2013, 3.6% of all deaths were among Marion County residents as a result of overdose. That's up from 0.04% of all deaths in 2000. So from 2000 to 2016, the rate of fatal drug overdose among white residents increased 12-fold, from 17 to 207. And the rate of fatal overdose among residents of other races increased 5-fold, going from 11 to 63. Drug overdoses affect all members of the community. This chart displays the overdose deaths by race and ethnic group. 79% of the deaths from 2000 to 2016 were white, non-Hispanics from 2000 to 2016. The rate of fatal drug overdose among white residents increased 12-fold, and again, it increased 5-fold from 11 to 63. The overdose death rates increased among all races. This graph shows fatal drug overdose deaths rates by race in Marion County. Again, and this graph shows the rate of death per 100,000 people. So this indicates that overdose deaths are increasing in whites, African Americans, and Hispanic Latino populations. Among gender, this graph shows overdose deaths among African Americans by gender in Marion County from 2010 to 2016. This indicates overdose deaths have increased in African American males from 13 deaths in 2010 to 46 deaths in 2016, which is about a 250% increase. This also indicates an increase in overdose deaths in African American females, going from 9 deaths in 2010 to 15 deaths in 2016, which is about a 6% increase. All age groups are impacted by drug overdoses. Residents ages 25 to 54 represent 75% of all the overdose deaths. So drug overdose impacts both genders. This graph displays that males make up the majority of the deaths each year, but the female deaths are increasing each year as well. The increasing number of women is important because some of these women are in the childbearing age group. So this increases in drug-addicted children, and the deaths could increase children without mothers. Although accidental drug overdoses are a county-wide problem, some parts of Marion County have been disproportionately impacted by the epidemic. In 2015, the number of overdose deaths was highest in zip codes 46201, 46203, and 46219, which are adjacent to one another. And more than 40% of all overdose deaths 2015 to date in Marion County have occurred within the boundaries of these 4 zip codes. And these zip codes are mostly on the south side of town. Overdose ambulance runs have tripled. In 2014, Marion County saw 687 non-fatal emergency department visits due to opioid overdoses, the most in Indiana. Our Indianapolis Emergency Management Services has seen a 300% increase in overdose calls from 2011 to 2016. So in 2011, ICMH responded to 565 overdoses. 2016, we responded to 1,818 overdoses. As for pharmacy robberies, in the last 5 years, Indiana leads the nation in total pharmacy robberies. We had 499. In 2015, Indiana had more pharmacy robberies than any other state. Marion County had 132 of Indiana's 175 pharmacy robberies. The entire state of California had fewer than Marion County. In Marion County, 87% of the robberies were with the same retailer, CVS. So now CVS has installed narcotic safes in approximately 150 Indianapolis stores in late 2015. So those robberies have significantly decreased to date. In the last 5 years, in 2016, Marion County had 42 of Indiana's 78 robberies. This was in 2016, a decrease of 68%. Indiana was ranked second in the nation behind California. Neighboring counties and states are seeing an increase in robberies, and many are being committed by Indianapolis residents. Though Marion County had fewer robberies last year, this could mean that Indianapolis sees those drugs stolen elsewhere, brought into our streets to be sold. A little bit about the heroin seizures by IMPD, Indianapolis Metropolitan Police Department. Reports that heroin seizures have increased from about 300 grams in 2012 to more than 13,000 grams in 2015. Marion County had 2 record-setting years for homicides, 2015 and 2016. From 2010 to 2016, there was an increase in homicides from 108 to 157. In 2015, Marion County had 426 non-fatal shooting incidents with 473 victims. Former IMPD Chief David Allender attributed this increase in shootings and homicides to more drug trafficking and increased heroin use. Unfortunately, there are many more children being placed in foster care. There's an increase in substance abuse by parents, which leads to more children being placed in foster care, or sometimes with elderly grandparents. So in Marion County in 2013, 2,300 children were removed from the care of their parents. In 2015, that number rose to 3,776. In Indiana, the increase in number of children in foster care from 2013, 12,382 children in foster care. By 2015, 17,023 children in foster care. So let me share with you a little bit about what the Substance Use Outreach Services Program is doing in our efforts to respond to the opioid epidemic. We have outreach workers and case managers on staff, and anyone can make a referral to our program, and if they may have family members or someone struggling in their community with an opioid epidemic, problem, we can do an assessment on them and get them into treatment. But not only can we get them into treatment at Salvation Army Harbor Light, but we can pay for their treatment. So if you or someone you know has a problem, it doesn't have to be opioids, it could be alcohol or any other drugs, but we can connect them to care. And if they meet our requirements, which is they lack the funds to get into treatment themselves, and oftentimes family members have run out of funds to pay for treatment, so we're very happy when they find out that we can provide services or connect them to services and help with the cost of that. And with Salvation Army, they provide detoxification, as well as residential and transitional care, and they're monitored by a physician, and then they get a chance to participate in group meetings. They have a counselor, so it's a comprehensive program, and they can stay there anywhere from 4 to 6 weeks and longer if they desire to, and as long as they're in compliance with the program. So it's a really good program, and again, if you need further information, I would love to talk with you. My staff person here, Deidre Coleman, would be happy to talk with you and provide you with more information. We also have a mobile unit that we have just gotten about a month ago. So we'll be out in the community. We'll be providing free HIV and STD testing and hepatitis testing. Hepatitis testing is very important, particularly for those individuals who inject drugs. So we want to offer that free of charge. So again, you got a neighborhood, you got a church, you got somewhere where we can pull that mobile unit up to, we will be more than happy to provide those services. And we have a toolkit. I think, Carol, I left that with you last time, but if not, I can share that. And this toolkit has information about treatment facilities, support group meetings, NAAA, so a whole list of information that we provide to the community. We have hard copies as well as we can email them to you. And the last thing, because I know I'm running out of time, we also provide naloxone trainings. So again, if you have family members, if there's someone in your family, if there's someone in your community, if there's someone in your church who's struggling with this addiction, and it would benefit you to have a naloxone kit. Naloxone is the medication used to reverse the effects of an opioid overdose. So we can provide that training to you at any location and give you a free kit. Those kits cost about $160 if you go into the pharmacy, which you can go to the pharmacy and purchase. But we can give you one free of charge if you participate in our training, which only is about 45 minutes. Okay. So I have more information, but I will stop here. And if you have any questions, please, yes, ma'am.
My district's being settled in, but what percentage in this area is heroin versus pills? You know what it breaks down?
No, ma'am. I don't know that. I guess I could. We might be able to. I'm looking at my epidemiology staff. We might be able to get that information, but I don't know.
Because I think maybe different parts of the city might have different issues here.
Mm-hmm.
So, that'll help me.
Okay. Oh, okay. Yes, ma'am. Yes, sir.
Can we just email you to get a copy of the slides? Is that possible?
You sure can.
Okay, thank you.
If you're registered with Debra's permission, we'll get this out to everybody. We'll keep you connected. That's our goal.
Awesome.
Absolutely.
I noticed that agents were not included in the data.
I'm sorry?
I noticed that agents were not included in the data.
Asians?
Yeah.
That number is so low that we wouldn't have that information. Okay, thank you so much. Oh, I'm sorry.
With the mayor's upcoming focus on trying to divert people out of the criminal system into a health system, do you feel that you have adequate resources to be able to address that?
We don't have enough resources, absolutely not. But that's why it's important that we partner in the community and partner with other professionals so that we can provide more services. And the funding that I'm talking about as far as providing it to persons in the community comes from the Marion County Health Department's budget. Dr. Kane has allowed us to use part of our funding to provide this funding for treatment, but we certainly don't have enough services. We are working with Project Point, which is part of Eskenazi's Health Center, and ICMH, and some the chief of police. We're working with several members of the community so that we can share resources and provide many more resources within the community. But we do not have enough resources, unfortunately. We do, and Debra has, she has my card, and we can, okay.
There's a space on the table if you want.
Okay. Yes, ma'am.
Any work with the prescribers versus treating the individuals who are using? Is there any work being done with prescribers?
Not, the Substance Use Outreach Services Program does not. You have to come in.
I know the Health and Human Services, excuse me, for the federal, is got some webinars and things they're starting to do. I know also from professional licensing agency, the medical licensing board has been working on, as I understand it, some things for regulating prescribers and trying to get control of that. So
Can you speak up a little louder?
Can you repeat that? Stand up and speak, we can't hear you.
Come up here.
I was saying that Eskenazi and Midtown, they're working with the prescribers to train them how to not prescribe opioids and how to control pain without prescribing opioids. So yeah, I'm one of the epidemiologists working in their program.
And one of the things Project Point does is goes out with the on the mobile unit, and they have a social worker and a doctor and I think a recovery coach. And so they're and once they identify someone who's suffered an overdose, then they connect them to care, to treatment, get them connected to the services that they could benefit from.
I'm wondering if there's, like, to remind me, is there any of that fund set aside for complementary and integrative health techniques like massage, for instance? It's research shows it's wonderful for pain. And I'm wondering if they added things like that, that would be more helpful than the medications.
Now, I've done some research where I have actually seen that it is beneficial, but as far as local funding for that, I have not seen that. I don't know.
I have to be a nurse and a massage therapist and a psychologist. So.
Yeah. Okay.
That's where our congregations can really step.
Yeah.
That's where our congregations can really step.
Yes, yes.
Yeah, absolutely. All right. Well, thank you so much for the questions.
How's everybody doing? That sounds pretty good. I guess that's what happens when you feed people. They sound pretty good. Yeah, that's awesome. As you can see from your, well, you may not have my information out there, I guess. My name is John Girton. Here in the community, they just call us Pastor G. And I pastor the Christ Missionary Baptist Church, which is just right down the street off of 30th and Martin Luther King. It's a 98-year-old church. Will be 99 this year, celebrating our 100th in 2019. And I have been there as the what I call senior servant for the past almost 3 years. It seems like it's been Debra, it seems like it's been 30 years, but it's only been 3. I was asked to speak about my experiences walking beside people with addictions in our community. And the thing that I don't have any slides, but the thing that I would say is of most value with the community is not who our church is, but where our church is. We are in an extremely challenged community, and it doesn't take a whole lot to walk or drive through and see the challenges physically. What it does take, though, is quite a bit of effort to see beyond the challenges and to see the value of the people who have, many of whom have survived a tremendous degree of challenges in order to graduate from high school or to get a degree or to work and provide for their families. And so we know as a institution that has been in that community since 1955. The church has been around since 1919, but in that community since 1955. We understand our role as a church, and that is to provide the spiritual aspect of someone's life, to be there for them spiritually, to share the gospel. If we were not doing that, we would be a community center, right? If we weren't doing that, we would be a social club, but we're not. We're a church. And so we understand that the spiritual needs come first. My father pastored in that community for 25 years. My uncle pastored there for over 50 years. So I've been in and around that community all of my life. I was baptized at the church that I now serve at age 7 in the early 70s. And what comes after the spiritual needs has changed from 1964 to 2017. I don't think anything I'm saying is rocket science. But it does point to a need to ensure that as an institution, you are in position to keep up with those needs. We did not have a drug epidemic. We did not have a family breakdown epidemic. We did not have an educational dropout epidemic. We did not have as many vacant lots and broken windows. We didn't have all that in 1964. Well, we have that now. We have squatters. We have children who are dealing with trauma. We have families who are dealing with all kinds of addictions. We have mental health issues. We have all kinds, and to add on top of that, this fear of being over-policed. Recidivism. Joblessness. The unemployment rate in the community that I serve in could be twice plus the national rate for those without jobs. And so if our needs are increasingly changing, how do we as a faith institution prepare ourselves to wrap resources around people to help them? This is the experiment. This is the experiment. We see people on the side of the road daily who need bandages that we sometimes don't have. Y'all catching that? We see people who need support, and as the time goes on, the community ages, the congregation ages, the building ages, the street ages, the homes age, right? And so because of that, it is an experiment. And what that experiment has, y'all somebody need to tell me, I'm gonna run out of time. Y'all say amen and I'll hurry up. See? I'm not saying amen enough. Yeah, that's the see? Now y'all saying hurry up as you sit down. Anyway, thank you. Anyway, as the community ages, what we have had to do is figure out a way to respond to a need irrespective of the resources that we have on hand. And that's not money. Sometimes that's people. Sometimes that's, it could vary depending on the need. And so what we've had to do is we've had to create relationships, partnerships, collaborations, many of which are not formal. There's no MOUs or MOIs that we have developed because they have happened in the form of relationships one-on-one, because institutionally we are high risk. Can I say that? Do y'all get that? As an institution, we are underfunded, under-resourced, so we're at high risk of another institution supporting us, so everything has to start at the level of a relationship. Let me give you an example. I've talked about Dr. David Boyle, who was a neonatologist with Raleigh Children's Hospital. He and I were on a panel together at JW talking about health or something about 3 years ago. We struck up a relationship 3 years ago. We didn't even talk for an entire year. And then when we got back together, he and I both said, we need to do something about infant mortality. And I said, hey, I've got a tent campaign coming up in 2017. Let's do something. So we finally sit down after a year of not even talking to each other, and we're able to come up with a way to bring information from Raleigh Children's Hospital all the way down on the corner of 30th and Martin Luther King. I know that was risky for Dr. David Boyle. Because when he went into those boardrooms to talk to those people and tell them, hey, we're getting ready to go down there and talk about infant mortality right there at the corner of 30th and MLK, they said, where? Yeah. We're going to do what? When? And what they found is that of like 10 of their main objectives for their organization, institutional organization, 10 of their objectives, they hit 7 out of 10 by coming down and talking to those people, many of whom were living right across the street from where the workshop, 8 and 9 months pregnant. So based on where they came, the people who needed the information the most, do I need to talk about that? I don't need to talk about the infant mortality amongst African American women. I don't need to talk about that, do I? Okay, so the people who needed it the most were right across the street. Right down the street, they came, hey, my cousin needs to be here. Oh, yeah, invite your cousin. Another young lady breaks down crying because a friend of hers, her friend's baby died that week. It was one of the statistics. But if we back up, we realize that this was risky for Raleigh Children's Hospital to do this. Why? It shouldn't be. It shouldn't be risky. I understand it, but it shouldn't be. It just so happened I just saw one of the ministers from my church. He and his wife came in, and we had an experience when we were supposed to be doing a podcast, and one of the nurses from Raleigh Children's came down, and she was going to do a podcast, and somebody brought some food in, and so when they bring food in, we say, well, we want to share it, so we got to find somebody to eat it. And so if you know me, I walked outside, I saw some people walking down the street, and I said, hey, are y'all hungry? Now, mind you, they're across the street, so now you really know me, right? He has a great story about that, but they're across the street, and I'm talking to them across the street. First thing they said, well, how much is it? I said, it's free. Then they look at each other. And then they start making their way. It's a lady, a young man, a stroller, 2 toddlers, maybe 2 others that are in the 12, 13, 14-year-old range. All of them come across the street. They come in, mind you, we were supposed to be working on a podcast. But because we made ourselves available, it's not who we are, it's where we are. Because we were in the right place at the right time, offering the right thing. Now, they said they were hungry, but that's not what they needed. I said something. They said they were hungry, but that's not what they needed. Food got them in. And when they got in there, I just need y'all to know, now these are my witnesses. These are my witnesses. That whole family shut the epicenter down. They had so many needs. It was ridiculous. And I remember, this is the one thing I remember most specifically, is that the nurse who came to do the interview did not know she was going to spend time looking at a baby to make sure that baby was breathing. We all had to look at the baby and say, okay, is the baby okay? Is the baby fine? And so she gets down on her knees and she gets to playing with the baby. I know what she's doing. She's not playing with this baby. She's examining this baby to make sure this baby is breathing. We were in the right place, right? And so these partnerships and these relationships are critical because that's where, for us, it begins. It began with Dr. Boyle and Pastor G having a conversation at the JW Marriott Hotel. And before you know it, we're making a positive impact in the community. As part of this experiment, one of the things that we've learned very specifically is that what people show you is not what's really going on. And again, I got one of the first people that walked in. We hadn't even had the epicenter open. Oh, by the way, y'all saying epicenter. What are you talking about? That's not the church. Okay, all right. Here's the deal. The church is at 1001 Eugene Street, which is on the corner of Raider and Eugene, sort of up in 35th MLK. what we recognize is that in order for us to be available to the community, many of the folk in the community will not come into the church. We can talk a whole lot about that. All right? Many people will not come to the church because the church in that community is for funerals and weddings. Nothing else. You got it? And so since it's partially for funerals, who wants to do that? So we just don't go there. And so one of the things that we recognized that we needed to do was to have a place where the barrier of entry was low enough that folk felt comfortable enough to go in. And that's where the epicenter comes into play. The epicenter is physically on the corner of 30th and Martin Luther King, or maybe Martin Luther King and really Raider. Right there on the corner, there's a strip mall. At the end of the strip mall is the epicenter. And it's inside the epicenter that we set up this, what we call the We Care network, that was designed to allow people to come in. And so when the family came in and we said there was a lot of needs, the reason why we know that there were needs is because we set up what we call intake specialists, who literally sit down with those individuals and say, what do you need? And they begin to talk. Okay? Takes some time, takes some trust. But over time, they come to understand, you know what? Those people really do care. And then you start having people coming in saying, my brother told me to come over because they said y'all were helping folk find ways to get jobs, or you're helping people find a way to deal with addictions, because other people left, told someone, and sent them back. Okay? So the other example I was going to say when I was talking about the epicenter was that before we even opened our doors, Sister Joy, who's sitting in the back, she's shaking her head because she had to sit next to me. We weren't even ready. We weren't ready for anyone. The lady came in. What did she come in for? Did she come in because she was hungry? I don't remember.
She was looking for an apartment.
Yes, that's it. She said, I need a place to go. It was her and the son had to be 4 years old. We're not even ready. She walks in needing a place to stay. We don't have our forms or anything. So I said, Joy, come, sit down. We got to talk to this lady. So Sister Joy goes, grabs a sheet of paper, and we're talking. Now, I'm not the guy. I'm just the pastor dude. So I don't have all the right questions. I don't know the nomenclature. I don't know all the right words. I don't know. But Joy does. And so Joy, we sit down, and before this lady gets up, she needs an apartment. She needs a doctor's appointment. Joy, help me out.
She needed child care because her son had not been to school. She needed, come to find out, she needed psychological counseling because her boyfriend had been killed by his best friend in her apartment.
Within like wasn't it like a month earlier or something like that? She needed help with her son, who was one of the young men who did a robbery and shooting over by the Burger King, who was now in jail. She needed somebody to call him. And y'all feel what I'm saying? We're there for spiritual help. But sometimes before we get to the Romans road, we've got to deal with all of this, right? And so it takes relationships and partnerships, and they're clunky and they're risky. We know this. We understand that. I know people shut down when they see Pastor G coming. I get it. It's okay with me. I'm going to just keep walking. Everybody's not going to do that. And I can't say that every church or institution in an urban community has figured it out. Most of them, the doors are locked. Monday, Tuesday, Thursday, Friday, and Saturday. While needs are all the way around them. And we get this. But until we come to the point where we recognize that we have to do what Dr. David Boyle did by taking back to Raleigh Children's Hospital a commitment to say, we've got to do what it takes to impact this number. And that means we got to go to a place where the numbers are really happening. And I'm cool, I'm stressed out, but I'm okay. But I just want to be honest. Yeah, I'm stressed out. Yeah. One of the main reasons why Carol knows this, some of y'all don't. One of the main reasons why Carol has me committed today is because I contemplated suicide. You understand? When you have to deal with burying 4 little girls burned up in a fire, And then you come to find out later that it was intentionally set. And that's this hour. Because next hour is going to be something different. In communities like that, right? Where you get phone calls to go to Eskenazi to stand beside and pray for a shooting victim you don't even know. When you get asked to do funerals for people that you meet while they're in the casket. That's this hour. Okay? Because a lot of these people, they don't have a relationship with a church or pastor. They don't have a relationship. I always say they don't know the difference between church and church's chicken. They don't know. They're going to find somebody and tag. We're it. So I don't know if I'm supposed to do an ask or what, but I'm going to do one. Search or seek out relationships. Let's build some trust. I don't care if it takes a year or we don't do nothing. That's what happened to David Boyle and I. We took a year, didn't do nothing. And when the opportunity presented itself, we were ready. Was it perfect? No. Did we do it? Yes. Are we looking to do it again? Yes. Are we going to be bigger and better next time? Yes. Things have escalated to the point where some of y'all know, and I'm done after this. Our Urban Servant Leadership on Conference is coming up on January the 27th. That conference started with 75 people at Brown Mackey. 2 years later, we have over 435 people registered. And it all started with just a tent. Just us hanging out on the street, talking to people on the street. You know, pushing people around in wheelchairs at 3 o'clock in the morning. That's what we did.
We have a flyer for your...
Of course not. That's too much like right. That is not perfect. No. The conference registration has been closed because we unfortunately have more people than we can feed. So we expect for a free conference that only 50% of the people will show and 20% of the people will show up who did not register. So we are already kind of at capacity. It doesn't mean you can't show up. You know, just be like, yeah, I heard what he said, but I'm going to show up anyway. Yeah, you can come on. It's at Martin University. January 27th begins at 8. The registration opens at 8. Conference begins at 8:30. It's the Urban Servant Leadership on Conference. And if y'all give me 2 minutes to talk about urban servant leadership, because this is my thing. Those who work in communities like that, who are urban servant leaders, do not do it because it makes sense. We do it because we're called. And so if you approach anyone in a community that's challenged, don't approach it with your head because it won't make sense. Nothing you see will make sense. You have to approach it with your heart because that's why we do what we do, right? We've got people down there with PhDs and master's degrees that can go do a whole lot of other stuff than hang out and do the kind of things and get treated the kind of ways that we get treated, with the death threats that we get and the folk calling and asking for stuff and they run around asking every church for $5, things like that. We could do a lot of other things, but when you work in an urban community, that means you know what you signed up for, right? It's like you signed up to be spit in the face. But we're committed. We're not going anywhere. So I think that's one of the most important aspects of working with people in communities like that, is that chances are they're working 2 and 3 jobs to make it work. They can't focus in on all of your issues. They can only focus in on what they can focus in on, right? And then they got to go do something else. But the most important thing is that they're called to do it. And they're not doing it because it makes sense. Are there any questions? Thank you.
challenge you to be people of prayer. Take these prayer requests and concerns to your faith community. Ask your clergy leaders to mention out loud in your gatherings these concerns, and ask yourself, am I being called to be part of the answer?
Good afternoon, everyone. All right, so I'll start with a shameless plug for my job first, and then I'll share a little bit of my story. Yes, ma'am. I was going to. Okay, so my name is Natasha Cheatham, and I am the project assistant with Drug Free Marion County. Drug Free Marion County is a local nonprofit that offers grants for drug prevention programs, and also provides drug prevention awareness and education programs as well. So I have him pull up our website, and I wanted to talk about this just a little bit. So we do have a treatment directory listed on our website. You go to drugfreemc.org and click on the link at the top that says treatment directory. There you will find various entities that have allowed us graciously to list them in our provider directory. And so you have some that are inpatient, most of them are outpatient, and they provide various services for those dealing with substance use and or mental health. If we have any treatment providers in the room, we would love to have you in our treatment directory, and we can talk more about that after I get done speaking and the person after me. Also on the back table, I did leave a handout on there with a quick list of resources and other information as well. Okay. All right, so a little bit about me. So I just celebrated on the 15th 8 months of sobriety. Thank you. Which feels kind of weird, in a good way though. It feels really, really good. It doesn't feel like 8 months. It has honestly went by very fast, but it's been good, and I plan on being sober the rest of my life. So, thank you. So my addiction started, well, actually, I'll go before that. So I was first introduced to substance use through my mother. At 8 years old, she, when I was 8 years old, rather, I saw various things that I didn't realize what they were until later. But at that time, she was using cocaine. So that was my first introduction. Then when I was a teenager, she started using prescription pills as well, abusing them rather. At 16, I had two very traumatic experiences back to back. I was sexually assaulted by 3 men, and then literally like 2 days later, my boyfriend was shot and killed on the west side. So that was when my addiction started. My primary substance of choice was alcohol. But at that time, I also used prescription pills as well. That lasted until 2016 consistently, so about 10 years consistently. So last May, I finally just got tired enough, and I said, well, I want better for myself. And I know that I was put here for a reason. I was chosen to help people. I knew that I wanted to go into addictions counseling, and I said, probably can't do that if I myself am addicted. And so I, by the grace of God, went cold turkey. I don't suggest it. But I went cold turkey, and I have been sober ever since. And so I wanted to speak today about how faith and the faith community at one point hindered my sobriety, but then turned around and helped it. So in the ways that it hindered, when my mother was also diagnosed with schizophrenia when I was about 8 or 9 years old as well. So there is the dual issue there. And so when she was diagnosed with schizophrenia, the church that we were currently a part of at that time, they physically took her medication and said, we can just pray and, you'll be fine. Unfortunately, that was extremely detrimental to my family, and things were never the same, unfortunately. In my own personal journey, the church hindered me in a way that just felt really judged, felt like they thought that it was a choice. And in some regards it is, but once you are addicted to a certain point, it's honestly no longer a choice. Your choices are completely inhibited. No matter how much you want to make the right decision, you don't. Because the only thing you can think about is feeding that need, feeding that high, whatever the case may be. And so there were a lot of times where all I wanted was just some support, but instead I got a sermon. Instead, I got unwarranted prayer by an individual who shouldn't have been praying for nobody. And and so it kept me out of the church, and it kept me addicted because I didn't have a supportive outlet at that time. I was surrounded by people who enabled me to continue to remain bound by addiction. Last year, I took a very proactive, a few proactive steps rather, to turn my life around. One of them was joining a church, which was a harder decision than what I would have thought. But after suffering from church hurt, which I'm sure most of you have heard that term, and if you haven't, it's simply just being hurt by the church. After suffering from church hurt several times over from different churches, I didn't want to join the church. But my best friend invited me to his church, and I've been there ever since. My church is Powerhouse Church of Deliverance. We are going on celebrating 6 years of existence, which is awesome. And they have been very, very supportive every step of the way since I joined. The first day that I walked into the sanctuary, they said, "Welcome home." And so I've been there ever since, and they've been very supportive. They check on me even when I don't want them to. And they have been instrumental in rebuilding my faith, not only in God, but in people as well. I had completely lost faith in people, and they've helped with that. They also helped me to understand that I am not my mistakes. That is something that I had not experienced before with a faith-based organization. They didn't see me as what I did, who I was, or anything of the sort. They just saw me as the person that I wanted to be, and they wanted to do everything to help me be that person. And so I'm very grateful to be a part of a faith community that is so affirming and so supportive. And I'm also grateful to have a God that's so gracious and forgiving. I did that without crying. I'm very proud of myself. So, I will take questions because if I do keep talking, I will cry. Does anyone have any questions? Yes, sir.
Did you have to change your circle of friends and your environment to support your sobriety?
Oh, absolutely. I had terrible people around me. And not terrible as in they were terrible people, but they were people who were making terrible decisions and stuck in where they were. They didn't want to change. They didn't want anything different. They were perfectly complacent in where they were. And when I started changing and I wanted different, it got ugly. But that's okay. They're no longer in my life, and they're doing what they're doing, and I'm doing what I'm doing, and I'm doing it pretty well. So, anyone else? Yes, sir.
I'm wondering if you can share, the bad experience you had in the church, and what is it? What are the attributes the new church has, and how can we, I guess, be part of helping churches transform and become more supportive and more?
Honestly, I think the biggest change is that my church is very young. It's mostly millennials. We're all in like our 20s. Even my pastor is like 30. So I think that was the biggest thing. Most of the other churches that I had been a part of, they were older congregations, people who were like 50 and older, 60 and older. And the population of people under 30 was very slim.
Was it generational?
It was definitely a generational thing. And then also I think exposure has a lot to do with it. I think if people haven't been exposed a lot to adverse situations or, they don't know how to deal with that type of thing once they see it in their congregation. Anyone else? Yes.
For you, as someone who's you're an older millennial, but for you with working with that and that being a generational gap to you, how do you provide support to someone who I guess is growing up in a different era than you did, and how would you recommend providing that type of support with the age group or with the age gap?
The way that I provide support, and I'll suggest anyone to provide support, is first and foremost, listen. Listen, don't come in with any preconceived notions. Don't come in thinking you have all of the answers. Don't come in thinking that you know better than them, no matter how old that they are. Listen. They will tell you what they're going through, and they will tell you what they need. Listen. The other thing, listen, I can't say that enough. But the other thing I will say is, if in any way possible, if you do have a young person around you, talk to them. Learn the language, the lingo that's out right now. You may not want to, but take like 5 minutes and watch a YouTube video or something that will help you be better connected with the generation now. Because being so disconnected from them is going to be harder and harder to connect with them and to help them when they really need it. Anyone else? Pastor G, you look like you got a question. Oh, thank you. Thank you. Well, yes.
That's awesome that you told the story, because it's, you don't often get to see inside someone's being and how they work with themselves. So it's really awesome.
Thank you. I truly appreciate that. Thank you.
I just have one more.
Yes, Carol.
Other than your congregation, what is your other accountability persons or groups, or do you have any?
Oh yeah, I have multiple. My blood family, even though we've been estranged most of my life, they've really come in as a support. And then I've kind of just redefined family for myself. So there are people that I have adopted along the way who have been so good to me. And whether it's I've known them for 6 months or 6 years, I have just honestly kept them around me. And I've learned to have more discernment when it comes to the people around me. And so if your vibe is funny, I'm not fooling with you. But yeah, so I have multiple groups of support that I pull on in various ways and at different times. Mm-hmm. Thank you. Well, thank you all for listening.
Good afternoon. My name is Ben Evans, and I work for Family and Social Services Administration. And I probably said this here before, but I'll say it again. So Ronald Reagan says the scariest word you'll ever hear is, "Hello, I'm from the government, and I'm here to help." So I'm here to scare you guys this afternoon. But thank you guys so much, Natasha. Thank you so much for your testimony. What a blessing. And I am so thankful that the scripture includes people that have struggled. Right. You know, sometimes we think that we hold up just but I was reading not too long ago, Peter, he struggled to deny Christ, but then Christ turned around and restored him, and how Peter went on to minister, and then, Abraham, David. I mean, you just look just people that are real people. But sometimes we're afraid to be transparent and to be real. And so thank you for being real, and thank you for sharing. And Pastor G, I'm going to hit what we're trying to encourage, but thank you for what your church is doing. That's exactly what we're trying to get churches to do around the state. And so thank you. And Debra, I do have to say, I'm always nervous following you because at Christian Theological Seminary, Carol had me come and speak in the afternoon. It was back in the fall, I think. You spoke in the morning. And I decided I was going to speak on Health and Human Services Toolkit. And so Debra got up and she went right through everything on the Health and Human Services Toolkit. Pastor G, have you ever had that happen at a conference where somebody got up in front of you and spoke exactly about what you were going to, And so I was like, great. So I said, I'll pull out some of the resources that we have and I'll share those. But it worked out. So I was a little nervous when you got up, but fortunately we're okay. So. Carol wanted me to share, I'll share a few examples, and it's amazing because we're trying to encourage churches. So my job is to do outreach to faith-based and nonprofits around the state. So my background was a youth pastor for about 10 years, and then got into government work, federal and then state. And so I've had a burden for when this position was created. And I heard that the former secretary, Dr. Warner, was looking at creating a position like this. I went to him and said, hey, I have a background in ministry, and I also have a background in government. I'd love to be able to help do this. And so that's been my burden, is to travel. The state has the benefits, but it's you guys that wrap around people and give them hope. We're transactional. You guys are transformational. And that's what people need, as Pastor G and Natasha have shared. The benefits and the state is not going to be able to do it. It's got to be that community, those relationships that Pastor G was talking about that come around people and give them hope and provide that community and that support. A couple of things that I've seen so far that I want to highlight. H2O Church is down in Austin, Indiana. And I visited there a couple of years ago. When the drug epidemic hit at Austin, was kind of Scott County is when it first came on, kind of the state awareness, but also a national awareness, got a lot of national attention. Billy Snowden is the pastor there. He's a lay pastor. He works for the Department of Child Services as a trainer. And it's a cinder block church. It's painted blue and white on the outside. Nothing fancy, not a mega church. Just a small kind of cinder block building with a little gym in the back. And Billy just did what Pastor G talked about doing, just opened his doors and said, what can we do? And so he started letting them host AA meetings, NA meetings. It wasn't Midtown, but it was the Centerstone, I think, the local mental health provider down in that area, came in and did some services for youth in the afternoons. And that was what really impressed me, is as a church, you don't have to have a huge budget. You don't have to have a lot of people. He started that church basically just as a vacation Bible school for children in the community to come on Sundays. But when this started happening, he just opened his doors and was there for his community. And the people in his church that were involved at the time just did the same thing, developed relationships and helped. And that's the idea. You don't have to have a program necessarily. Billy himself at the time didn't have programs, but just looked to partner with other people in the neighborhood that did, and that could come in and that could help and be involved. And it's made a huge impact in the community. I have a video that eventually I'm going to get on the website, and I'll get that to Carol. I showed it at the Christian Theological Seminary, but just where they interviewed Billy and some of the people in his congregation, they talked about the impact that church had had in the community just by being there to listen, as you said. Mm-hmm. And I think that's what we don't do a lot of times. We don't listen. We're quick to give our advice, and we're quick to sometimes to judge, unfortunately, instead of listening and walking alongside. So H2O Church, that's a great example. Volunteers of America. Are you guys familiar with Volunteers of America? I want to highlight what they are doing. And they're a faith-based organization, so they do a lot of outreach for veterans, homeless veterans. But they also have, in Indianapolis, a home for mothers that are addicted, pregnant mothers that are addicted. And the mothers are able to come in, they're able to help them with treatment to be able to get off of whatever their addiction is, and to be able to have a healthy, the child can then have a healthy birth. And so it affects a lot of things. It affects infant mortality that Pastor G was talking about. and just the fact that it's helping the mothers become strong and able to provide a home for that child free of the substance abuse that was involved before that. They have one in Indianapolis. They just started one, or they're getting ready to start one in Winchester. So they'll draw from that side of town. And then I know they're going to be applying for, there's probably some others. So mental health and addiction, Indiana Mental Health and Addiction is going to have a couple of requests for proposals coming out in February for locations to go south of Indianapolis to the southern part of the state to be able to do something like that. But another great example of just the faith community looking for a way to impact people and to provide support. And then there's a lot of other examples. Debra shared the last time I was with her when I was joking about, if you go to hhs.gov, and I'll get the specifics to Carol, she might already have them, but that toolkit that HHS provides for churches and ministries to be able to have some ideas on how to get involved in your community.
There's a few on the back.
Oh, good. Okay. Okay.
There are a couple of things you left.
From the last time. Good. So there's. Okay, great. There might be some back there, but it's a great toolkit. Just gives some practical things, like opening your doors, different types of recovery programs that you can have. But I think the biggest thing is just, as Pastor G and Natasha shared, is just being willing as a church to listen, as a house of worship to listen. And we've got to, the government, I think sometimes the government has a place. I'm not saying that. But in Indiana, there's over 6,000 houses of worship spread out across Indiana. And just think of the impact if each of those churches would do what Pastor G is doing here in his section of Indianapolis. What Shepherd Community is doing in the 4620, or that zip code, one of the zip codes where they're hit with a lot of these issues that they're facing. What other churches are doing. Just think if all 6,000 houses of worship, and that's all different types of faith congregations, but if they would be involved and try to impact the area that they are, I think we could start to see a dent in some of this, because we know it's not going to be the state, the transactional part of things that's going to change people. It's going to be the transformation of that faith walk and things that are going to help people. Let me share just a few of our resources. Back on the table, are there any more of these resource guides back on the table? I'll try to run out and grab a few more. These are excellent. Like for the Epicenter, this one will follow up with you guys. What we tried to do when I started working a few years ago is take out all the lingo so that you didn't have to know, I need to go to Department of Family Resources to find SNAP, which is the food assistance. So in the resource guide, we have it now by need. So if you needed a SNAP program, you would go to Food and Nutrition, and in here it would tell you exactly what the SNAP program is. It would tell you what office you need to go to. It would tell you what paperwork you need to have, what to expect when you go into the office. And the idea that I had behind this resource guide is not for you to give somebody a piece of paper and say, here, go to this office and they'll help you, but for you to sit down, or for the church or the nonprofit to sit down with that person and say, hey, what is your need? How can we help you? And then help them walk through that experience together and to help them find the benefits. So a lot of different areas from the state, benefits that are by need. Also, our website has recently been redone. So if you go to in.gov/FSSA, it's also by need now, so you don't have to try to navigate through which department to find services. And then I want to highlight one, if it's on your...
Repeat that again?
Yes, in.gov/FSSA.
Thank you.
Sure. And then if you go down, it says connect with services in your area. And I should have had this on a PowerPoint, Charlie, I apologize. But I'll give you an example. There's medical professionals, medical places, FSSA locations, child care, addiction services is now on there, and FSSA programs. But if you click like child care and accept the disclaimer, right, because government, we don't accept responsibility. And so age group, infants, and let's just go next filter. You want Monday through Friday, next filter. license center, next filter, CCDF provider, and let's just do search. This will bring up a data map with locations close to where you are, and it does that for each of these things. Evan, it's good to see you. Yes. Sorry, just saw you there. So Evan does the same type of group meeting on the north side of, side of town, so anyway, thanks for coming. But it provides, okay, squirrel? No, it provides locations. It provides locations, and if you tap on that, it'll give you the address, the hours of operation. But it does that for professionals that take, like if you needed a nurse practitioner that took Medicaid, it'll provide that for you. We're partnering with 211 to also get on here a community resource section, so that eventually we'll have 211's information on there, mapped the same way is the goal, hopefully, that will be a one-stop kind of location for you to be able to use. A couple of the other things that are coming up. Open beds is something I'm looking forward to, and some of you might be aware of it. So open beds started on the East Coast at a doctor at Johns Hopkins University who wanted to have a way during times of emergency. So let's say the stage collapse that happened here a few years back at the state fairgrounds. So when that happened, you could go to open beds on site and you could see, okay, Eskenazi has 5 emergency beds open, Methodist has 3 emergency beds open, and quickly get people to services. What we're doing is we're working with them to take that and have all the treatment facilities around the state on this site and partner with 211. So you can do one of two things. If you're in the hospital and you're a physician and you want to log on and you have somebody that's ready for treatment, you can log on and find a place where they're located, if they have an opening, what insurance they take, and get that person plugged in. But let's say you're Pastor G and somebody comes into the epicenter and they say, hey, I'm ready for treatment. You could call 211 and you could say, hey, I've got somebody here that's ready for treatment. 211 will then do the same thing for you and get you plugged into a location. So I'm hoping that's coming by this spring, if not sooner. And we're also, and announcements will come out about this a little bit later too, we're also shifting some of our focus to be more of the whole person at the agency. And I know Department of Health, FSSA, so the social determinants of health. So doing what you guys at the epicenter are doing. So when somebody comes in and they need help for Medicaid or HIP, we're not just helping with that, but we're also looking at holistically the whole person to say, okay, do you have housing? Do you feel safe? Do you have food? And those different things. And so we're starting kind of on the data side of that, looking at what the needs are, and then that's going to be pushed down, but more will come about that later. And then also on the back, I have, we're starting a new campaign, and it's going to kick off next week, but I have brochures that I was able to get a hold of about knowing the facts about opioids and opioid addiction. And as Natasha mentioned, so many times we do think of it in churches, and so I'm going to be involved hopefully in reaching out to churches on this aspect, but we think of it as, well, it was a choice. You just made a choice, but as Natasha said, the science behind it is, yes, a choice in the beginning, but once you're addicted, the chemical processes and things, and we have a video online where Dr. Waffle, who's a medical professional, explains it much better than me just kind of saying this, but where it becomes it's a disease, and you need that medical assisted treatment to go along with that and to help. And so I hope you'll pick up one of these and look for more to come as they start to do this anti-stigma campaign, trying to make it so that hopefully when people do walk into the church, regardless of generational issues that are there, that everybody will understand, hey, go listen and understand this. There's more to this than just a choice, but there's treatment, recovery is possible are the 3 facts that are on here. But feel free to pick up one of those. And that's all. Do you guys have any questions? Yes?
Something I just happened to look at that resource book last night.
Yes.
The copy I have, the mental health is not marked, it's under transportation.
Okay, so that could be no. We have a mental health and addiction tab, so maybe you got to create. It might have. Yeah, it might have. So.
I was going to say hard to find.
Yes. Hopefully it's better now. Let me give you my email address. Okay. Yes, ma'am.
On your FSSA website, how do you actually get on that? Are you plugging into the 211 and pulling information?
If you go on this one, it's up at the top, left-hand corner.
Yeah,
Went
how
right-
do you get your name listed on there?
Oh, how do you
It's
get-
going from 211, so if
Yes.
you're registered with 211.
If you're registered with 2-1, eventually your name will be on there. Right now, it's just people that are registered to use Medicaid, to take Medicaid, and the child care that are registered with our Early Child Care Development Center. Yeah, yeah. But eventually with 211, if you're with them, then we should have that data. So my email address, and please, just as long as it's between my government hours of 10 o'clock and 2, you can reach out to me. Benjamin.evans@fssa.in.gov. Benjamin.evans@fssa.in.gov. I would love to come talk to you about your ministries, your outreach, your facilities that you have, nonprofits or otherwise. I'm looking forward to connecting with Pastor G and learning about the Epicenter. And any way I can help, that's what I'm here for. We'd love to do it. Thank you, guys.
Hi, my name is Kimberly Miller, and I'm a project coordinator at Indiana Addictions Issues Coalition, a subsidiary of Mental Health America, Indiana. Okay, I'm also a person in long-term recovery from substance use disorder. I'm also a member of Emmanuel Missionary Baptist Church of Dr. Darrell K. Webster. I believe he's partnering with you guys. Thank you very much for the work you do. I'm also a grandmother raising grandchildren. That from having a daughter that fell victim to a fatal overdose in February of 2017. But what I'm here to talk about is part of the solution. While it might not be all the solution, it is part of it. First, I want to thank you, Debra. She helped myself and my daughter get into treatment at one time. Pastor G, thank you for what you're doing in the community. It's like my pastor says, it starts in the community. And my church is located at 46218 zip code. That's right there. Natasha, where'd you go? Thank you. You did phenomenal. It takes a lot of courage to get up here, especially in front of people that do not understand. They do not understand. Ben, thank you for your resources as well. Actually, part of the solution that I'm referring to is through the SAMHSA grant, we train and provide recovery coaches. Okay, let me correct that. Peer recovery coaches. We also certify them, and it is a new profession to where a person with a lived experience of addiction and recovery walk side by side with those people that are suffering from addiction, that want into treatment or that are currently in treatment. I had a bunch of slides I was going to go through, but I'm just going to get right to the point. I have some information back there that tells the process. Part of this grant that I am coordinating calls for faith-based organizations to get recovery coaches in there as well. This can be a very handy tool. Debra knows, I believe, of our recovery coaches. And just to give you an example of how important recovery coaches can be as part of the solution. At one point in time when my daughter fell victim to an overdose and was in the hospital, she called me and she says, Mom, I'm sitting here with a piece of blank paper trying to figure out what to do with my life. And I don't know. See, had a recovery coach been there. But I'm just going to cut the chase and let you hear from a recovery coach that is currently working with Project Point at Eskenazi. You talk about front lines. I mean, while it's not the whole solution, it is part of it. And in my opinion, if there's a bathroom here, we need a recovery coach there. We need a recovery coach on every corner. All you have to do is walk through the communities drive through. You could probably fly through and see the devastation. I could go on, but without further ado, I would like to introduce you to a recovery coach. Her name is Jen, and she is with Project Point at Eskenazi's Emergency Department.
Good afternoon, everybody. So I do work with Project Point. We are based at Eskenazi in the Emergency Department. So anybody that comes in with an opiate overdose and receives Narcan, we go and talk to them and see if there's any sort of resources that they need for getting into treatment. We kind of find out where they're at. A lot of people, they just want to ride home. One of the biggest things of why Project Point was started in 2015 was just because we knew that people that were coming into emergency rooms with an overdose were pretty much given that piece of paper, and were not given the treatment, any sort of follow-up appointments, anything like that that they would need, and just that support. So recovery coaches, it's myself and then Gloria Haynes that work at Eskenazi. So we'll go into the room. We have a folder of information for, we deal with Midtown, which is dual diagnosis. So they go for a nursing assessment to kind of help with any sort of withdrawal, so they're not just sticking it out. Then they meet a clinician. They try to figure out if there's groups that they would want to attend, and then they can talk to a doctor about getting on Suboxone, Vivitrol, and then we also deal with NTP if people want to get into methadone. We refer to so many other places. We're learning about places every day. I had found out that there was a place in Bloomington for a patient that was having issues coming up to Indianapolis every day. And one of the biggest things that we try to emphasize is once you're a point patient, you're always a point patient. And it's awesome that I can tell you guys this, is we've had, I would say, 6 people within the past week that I've talked to directly that said, hey, I came in over the summer, I came in over, in August or whenever the case is, and I wasn't ready then, but I'm ready now. I had a guy just today before I came in, I ran into work real quick just to see if there's anything I could catch up on, and a guy called and he's like, I came in a month ago and I got your business card. Unfortunately, we're not able to cover every day, so sometimes we do cover Saturdays, but not always Sundays, and he had unfortunately come in on a Sunday, but was given our business card and reached out to me today, and I sent a referral over to Midtown for him to start tomorrow. And that is humongous for us when we hear that. And we're not only helping people get into treatment, but just kind of helping them with support for long term as well. So there's a couple patients that, I'm a recovering addict, so I know some of that mindset and how, you'll slide back a little bit and say, hey, I don't have to do any of this, I don't need it, I'm better, and then next thing you know, you realize once things start sliding back, okay, I do need something, I need somebody, and we're always there. And luckily we have patients that recognize that, and, I won't hear from them for weeks, I'll be calling them, but I don't really hear from them, and they'll call me and they're like, you know what, I'm sorry, and I'm like, it's okay, where are you at? Where can I meet you in terms of what you're needing right now? And a lot of times, we're not able to get them some of the things that they need, but we do, and we are collecting the resources so that we can help assist them getting in touch with the right people. So if they're homeless, there's a couple people we deal with directly that kind of help with that population. And we just try our hardest to make sure that treatment is a long-term, doable thing for them. Because I know myself, I was just like Natasha, my drug of choice was alcohol, and I quit cold turkey, and it was the hardest thing I've ever had to do. And one of the things that really kind of snapped for me was I was facing a third DUI, and I still hadn't hit rock bottom. It was when I realized that I was never going to live up to my potential and have really what I needed and what I wanted out of life, that I luckily went to Families First and did an OP program through them, and one of the counselor I had said, hey, I think you'd be really good for a peer recovery coach, you know, it's just emerging. And I spent every free time I had calling out to places and trying to find out who I could get classes from and how I could pay for it, because due to an injury, I was a chef for years, and due to an injury I wasn't making money at the time, but got money together and was able to take peer recovery coach classes, got certified, and here I am. And so having that experience, it helps so much when patients come in, because a lot of times they don't want to be in the hospital. You know, they see the nurses, they see doctors, and I can understand it's frightening. It's scary because a lot of times they've come in and there wasn't a peer recovery coach, and it was pretty much UOD, here's a piece of paper, you know, if you can please leave, you're discharged. And when I sit down with them and I say, hey, I know what this feels like, I am an addict, it's like everything in them, all this weight is just off of them. And they can finally, that rough exterior, if they're, you know, kind of complaining that they're there and they want to leave, and all of this. I had a guy last night who just broke down crying. And the nurses were just like, hey, he's going to be difficult to deal with. But the second I really started talking to him, he just started crying, and I realized exactly where he was at, and we were able to kind of get through to him, because he knew that we knew what he was going through. But through Project Point, I think we're really kind of getting onto something here, and really kind of meeting people again where they're at, and doing some good at Eskenazi.
I just want to bust a couple misperceptions, if I will, before we get going, because we have had some pushback from social workers and counselors saying that recovery coaches are trying to take their job. A peer recovery coach is not a counselor, but it complements the counselor. It is not a clinician, but they complement, and they are not sponsors. I have information back there. I want to thank you, Jen. I want to give you just a real quick, better idea. It takes somebody special to work in the emergency department. You have to realize that they are dealing with people that just died and came back to life. So that is a very important moment that they need to be snatched up. Again, thank you for what you do. And do we have any quick questions? I've been told we got to close up.
Is this a grant program through?
That we are training the recovery coaches? Yes. It's Indiana Addictions Issues Coalition. We are a subsidiary of Mental Health America Indiana. I have information back there. I have these slides which explains a little bit more about the grant. But if there's a bathroom in an organization, there needs to be a recovery coach. Just saying. Just saying. Is that it? Are we good?
We hate to hurry, but we want to respect your time as well. I have an invitation to have one more announcement of an event coming up. Natasha, you want to tell me what that is?
Hey again. So on February 13th, Drug-Free Marion County will be hosting an event under an initiative that we have called Above the Hustle. It is a youth-led initiative that creates and promotes positive prevention messages to other young people. And so on February 13th at 6:30 p.m. at the Church Within, and I can share a flyer with Charlie or Carol so she can get that to you. and the topic is what is addiction, and so we have some youth serving individuals and some youth on the panel, and a youth that will be facilitating that conversation, and it is open to you all, and we would love to see you there.
Next month, we're talking about mental health and faith issues, the things that we wrestle with, the hard questions that we deal with that might keep us from even talking about mental health at all. So we want you to come and bring those tough questions. For example, is a person that has a diagnosis of, say, schizophrenia or some other diagnosis, are they morally accountable? Does saying that they have a mental illness excuse them from their behavior? Or what is the intersection between faith and science? Is it either or? What are your faith traditions' healing practices? What's your answer to those questions? Now bring your own. We'll have a round table, or lots of round tables, and we will try to consolidate your questions and then voice the various faith traditions' views of that. And we want to be able to show you a model of breaking down stigma and talking about really sensitive issues, things that make us not talk about them. All right? So please come. Notice that's in your program here. And there's another very relevant topic coming up in March: gender-based harassment and assault. We need to talk about those things as well. So now the thing about pre-registration is becoming more and more obvious to us today because we ran out of food. So we need to have you pre-register a week in advance. So these are Wednesdays, so that means on by the second Wednesday, if you want to come and want lunch, then please pre-register on our website. Otherwise, just bring your own bag lunch, or just come, whatever. Okay? And take the sandwiches that are left out there. You can wrap it in a napkin. Yeah, I say we ran out of lunch. We ran out of cookies and chips. So take the sandwiches. Please pass the brochures out to your colleagues, to your faith communities. You are our best advertisement. When we become so convicted and moved, and I don't believe it's just us talking. I think God's Spirit talks to us through people and through raising these awareness of the needs out there. We have to take that seriously and go for it. All right, let's put ourselves on the line. Take brochures, pass them out to other people, invite them to come. And then please also take the handouts that are at the back as well, and I want to have someone volunteer if they would, and I'm sorry I didn't ask in advance, to close in prayer. First, let's have a moment of silence for the great needs that we have here, and I've been reminded again of the families that are being destroyed by the addiction issue, the children that are being hurt by the number of infant mortality through addictions, by the burnout from caregivers, families that have given up on those that are addicted, for pastors and people that are on the front lines working in counseling and finding roadblocks and discouraged by the amount of work or just so tired that they